I wouldn't get it. So myself, an assistant director.
Yeah, extra hands, right? Okay.
Can you hear it?
My volume's already done and my mic's done. Try to turn my volume.
Oh,
Yeah.
sorry.
Yeah, I hear something.
Is it echoing?
It's not like-
Sorry.
it's not echoing, it's just
Yeah.
Hi, Isaac. How are you? Okay.
Is it like fine?
Yeah, it wasn't like
It should be fine.
Pastor at the UC Riverside School Public Policy. And I will be serving as your MC for today's seminar by Riverside's Director of Health, Ms. Kim Saruwatari. This event is brought to you by the UCR School Public Policy and its Dean's Brand Ambassadors. This is our second hybrid event, and my peers and I are delighted to provide this service to the general community and those of us who are joining us in person and on Zoom and online. Before we get started, I first want to go over the format for today's seminar. We will devote the first half an hour to a discussion with our guest speaker, myself, and the Dean's Brand Ambassadors. We will then reserve the last half hour for an audience Q&A. Joining us on our panel today are a few of my fellow ambassadors. Please join me in welcoming Kevin Karami, Devin Sternberg, Cam Pollard, and finally, Kathleen Wen. Now, without further delay, I am pleased to introduce our guest speaker, the Director of Health, Kim Saruwatari. Ms. Saruwatari is the Director of Public Health for the Riverside County, California. She began her career in public health 20 years ago in San Diego County, and as the Senior Epidemiologist for Public Health, with an emphasis on communicable disease investigation and emergency preparedness. In Riverside County, Ms. Saruwatari was the Chief of Bioterrorism Preparedness and responsible for the Department of Public Health, and was on several emergency preparedness committees for the California Department of Public Health. Working with all other administrators and outside agencies, Ms. Saruwatari oversaw the development of plans for public health responses to emergencies such as the pan flu epidemic, bioterrorism attacks, and natural disasters. Ms. Saruwatari also served as the first ever Director of Emergency Management for Riverside County. And in this position, she was responsible for creating a new model for emergency management by combining all hazardous preparedness and response with public health emergency management under a single department. She holds a BA in molecular and cellular biology and a master's in public health and infectious diseases, both from UC Berkeley. Director Saruwatari, we are so honored to have you here with us today. To begin, I have a question for you. So for our fellow public policy students, can you please explain what you do in the day-to-day as Director of Public Health?
Sure, thank you so much for having me here today. It's great to be with kind of the future, right? You guys are the future, and I look forward to seeing all of you, hopefully in the workforce someday, and maybe even in public health after you are here listening today. So my job, what I love about it is it's different every single day. So in the health department, we have all kinds of programs. So obviously everybody's aware that we are first and foremost combating the COVID pandemic right now. So we have case investigators, contact tracers, laboratorians, data analysts who are day in and day out trying to monitor what's happening in the pandemic, guide our action so that we can try to get ahead of the pandemic, and also make sure that we're getting resources out into the community that needs them the most. But outside of COVID response, we have a wide variety of programs. We have our California Children's Services Program, where we provide case management and medical therapy to the most severely disabled kids in the community. So we have about 15,000 kids that we case manage, and about 1,500 of those that come in to see us on a regular basis so that they can learn how to do their activities of daily living. And we work with them, we work with their families. We have things like our field nursing program, where we are sending people out, our public health nurses out into the field to pregnant moms' homes and working with those pregnant moms to make sure that they're ready to bring a baby into the world and care for the baby, but also care for themselves, right? And make sure that they know how to access services that they may need. We have our Communicable Disease Control Program, where we investigate all kinds of diseases, our sexually transmitted disease program. We have a full public health laboratory. I could go on and on, but basically day to day, I deal with kind of the policy setting and oversight for the department. So I really see my job is making sure that the people that are doing the work day in and day out and that are out in the communities have all the resources that they need. So I make sure that we're getting the grant revenue coming in, the county revenue coming in. I make sure that we're in compliance with the law. I make sure that if there are any kinds of barriers, that I try to break them down so that the staff can be successful in their jobs, because we are about 850 people in our department, and we have amazing, amazing individuals that work with us. And so I just want to let them do their jobs because they do great things.
That's great to hear. Kind of going off that point, since the start of COVID-19, what would you say are like 2 or 3 of the biggest challenges that have come to light because of the pandemic, and how has that affected you?
Oh, great. So I think one of the big challenges that we've seen with COVID-19 is the kind of the clash between public health and politics, right? And so this is on the news every single day. People see this, and we live it out day to day in the health department. We have a country where people have a lot of different beliefs, right? And we have a pandemic where our job as public health is to protect the public. And so we implement policies and procedures like masking or isolation and quarantine. And most of the time, they aren't even implemented at the local level. They're implemented at the state level, but it's our job to carry them out, right? And so I think the biggest challenge has been trying to continue that work in an environment where there's a lot of opposition to that work. And there's a lot of belief that public health is overstepping and that we're treading on kind of constitutional ground. And so I think at times it's been disheartening because the goal of the public health actions is really to stop the spread of disease. It's not to infringe on people's rights, but it's to protect everybody, even those that can't protect themselves. And so sometimes that can be disheartening, but I also think it's an opportunity. I think it's an opportunity for us to educate each other, for us to learn how to, and to think differently about, well, then what kinds of measures can we put in place to protect the community and what will be more palatable for people? And so my hope is that it opens up a dialogue with everybody, whether you're conservative, liberal, somewhere in between, whatever the case may be, but that we can all come to the table and have really just honest, frank discussions about it.
Thank you so much. The next question that I'm going to pose to you is, how can someone who it doesn't necessarily come from a science background kind of still be a part of the public health sector and the public health community as a whole?
Sure. So my background, as you heard, I have a degree in molecular and cell biology. I can tell you, I don't use it at all in my day-to-day work. It is useful because I understand when the laboratorians, when they're talking, it does ring some bells in the recess of my memory. But I think, again, because we have such a wide variety of programs, you don't have to be a hard science major in order to work in our department. We do things like outreach and education with the community. We do things like home visitation. We do case investigation. So our jobs don't necessarily require a hard science because we're going to put we're going to give you the skills necessary to be successful. So we're going to train folks on the job. Really what you have to work in public health is a heart for community and a desire to collaborate with partners to make things better.
Thank you so much. That was very insightful. So I'll pass it on to Devin. I know he has a couple questions.
Yeah, awesome. So kind of going on to a little bit different branch, but kind of keeping it kind of the same. But like recently, like we've seen a lot of media around public health. We've seen different conferences, whether that be in person, on Zoom. We've seen different types of social media posts advocating for maybe like COVID testing or like different types of COVID variants. So how would you say that the role of media has in today's world? Like how has it advanced public health agendas?
Yeah, great. Thank you for that. And I would just like to introduce over here is Jose Arbayo. He is one of our public information folks. He's actually our senior public information officer. So when you talk about media, he's our guy. And so, I think that the media really plays a critical part in delivering the message, right? And so I know Jose and his team work really hard to get the message out to the community that we're trying to convey. And I think it's not always easy because you get conflicting information, right? I mean, you can find something, whether it's a website, an article, a blog that supports your opinion no matter what it is, right? And so we try to be very fact-based. And so Jose and his team are really good about checking facts, making sure that we have good sources, and really Jose pushes us to be transparent so that when we have data, we're sharing it with the public. When we know something new is going to be going on, we share it with the public. So I really think that the media can help us build that trust with the public so that when we have to deliver information, there is a new mandate coming into play, and hopefully that doesn't happen anymore, but we never know what the future holds. But that hopefully when we do have to deliver a message that may be hard for some, that we will have established a level of trust so that people know that we're coming from a place of wanting to do good and that we are being transparent. There's nothing that we're trying to hide, and that we really want to be there to work with them and protect them. So I think the media can absolutely be our advocate. And so that's why we try to really accommodate media requests for interviews, stories, writing op-eds, doing those types of things so that we can get our message out.
All right, thank you.
Sure.
Oh, Saruwatari, thank you so much so far. I mean, this is really insightful, honestly. And now that you talk about some of the challenges, one of the challenges that comes to my mind is like education. And since the COVID-19 pandemic, it's been kind of hard to contain that, especially like in schools with younger children. And so since after the pandemic has hit, how do you see the help for K-12 education moving forward?
Another great question. So I will tell you that on a personal note, I have 3 kids of my own. So I have one that's graduating from high school in a couple of weeks. And then I have a freshman in high school, and then I have a 7th grader. So, when I, throughout the pandemic, when I'm talking with parents and educators, I'm also living that experience with them. Because I know I was, a little bit wary of having my kids home all day, right? Trying to let them do Zoom and be responsible for themselves. There are a lot of challenges with the fact that we weren't, I think as a nation, really prepared to implement things like pandemic policies where we had to isolate and quarantine at home or shut down schools. I think we talked a lot about it, but we never really thought it all the way through and put it into practice. Or, at least kind of to the point where we knew exactly what we were going to do on a step-by-step basis. Having said that, I think that the K-12 system responded incredibly quickly and incredibly well to be able to continue some form of education for students. Was it perfect? No, nothing was perfect, right? I mean, we were dealing with a worldwide pandemic. But I think that we've learned lots of lessons about what students need to be successful. We've also learned more about kind of the need for that social interaction and how that aids in learning. And I think that we saw some of the downsides in some of the studies that we're seeing now about the mental health impacts on children, some of the even physical impacts, right? Because as maybe kids weren't in routine contact with teachers, some of the problems weren't reported that traditionally are by teachers. So I really think that we've learned a lot of good lessons, and K-12 educators, higher education, health departments, we have started a dialogue that I think is going to be continuing into the future so that we can really maximize on those lessons learned and make sure that if we have another type of infectious disease outbreak, whether it's a pandemic or not, that we're ready to implement some of those lessons. And I think a lot of those lessons are, that we really want to keep kids in school. That's everybody's goal. And we're only going to take action that would take them out of school if it was absolutely necessary. And, having said that, again, I would also say that in a pandemic, we're dealing with something that's completely unknown, right? We didn't know what this virus was going to do. We didn't know how deadly it was going to be. We didn't know how easily it would be spread, and we didn't know how children would be impacted. And so when on March 13th, the governor shut down schools, it was really out of just a large amount of caution, right? And the knowledge that we could have something that was really devastating to kids. Fortunately, it turned out to not be as devastating as what was originally thought. So again, I think the biggest thing is there are a lot of lessons learned, lots of dialogue that's been opened, and that we'll be better prepared for the next time we have to deal with something on a larger scale.
Thank you. And that just kind of makes me want to ask like a follow-up, like I know your background is microbiology and epidemiology. How do you think that's, prepared you as your physical health or to foresee,
Yeah, so I think that my background, I feel fortunate. I've had a lot of great opportunities in my career. Riverside County has been a great place to work. And so I grew up in public health in epidemiology. So I did a lot of outbreak investigations. And so I understand and have done case investigations, contact tracing. I've done a lot of data analysis over the years. And then I went into more of the emergency management side of things. So I was actually on the other side writing plans for how we were going to deal with the pandemic, which is kind of ironic, right? Because again, we wrote these beautiful plans, but they weren't deep enough. And I think that we really learned that. But kind of to get back to your question, I think that that kind of plan writing and emergency management piece helped me to understand that as a county, we were gonna have to make decisions with limited information. But we were gonna do that in partnership with all the people that were impacted by the decisions to the extent possible. And so I think I felt as well prepared as I could, being in a pandemic. I don't think anybody's really prepared for that kind of pressure and kind of the circumstances, but I feel like, you know, the background that I had, I can understand the science, I can understand the data, I've worked in a lot of the capacities that our staff were working in. And so I was able to be more kind of empathetic with what they were experiencing and doing. So. Sure.
On the point of education and media, because that's kind of what we're talking about for the past few minutes. You know, you also mentioned how public health has kind of really butted heads with politics and political behavior in the last couple of years because of COVID-19. What has been your experience dealing with misinformation? That is such an issue that's constantly being brought up. You know, and given your position, I'm sure you know had to deal with it a lot. So, what has been your experience like dealing with that, maybe on the social media, but also maybe actual interactions?
Yeah, it has been challenging. I have had to sit on my hands many times because and just full transparency, the last 2.5 years, I kind of have taken a break from social media, with the exception of I monitor our sites to see what people are saying. But part of that is because it is hard not to engage with everybody who says something that I know is not based in science, right, or not factual. And so a lot of times I'll say to Jose, hey, Jose, did you see that comment? We need to make sure that we correct this information, right? And Jose is very skilled at, and his team very skilled at, you know, going out and putting information out on social media to really correct some of that information. It's been hard because even people that are close to me have different views than I do, right? And so I try to be respectful of those views, but I also want to make sure we're getting good information out there, because if one person has bad information and they tell 2 more, and then they tell 2 more, then suddenly we have bad information that's out there that could sway people to not get a vaccine or to not isolate if they're diagnosed with COVID. So it is definitely a challenge. I have to be really kind of disciplined so that I don't get engaged in those kinds of back and forth. And I also have learned over the last 2.5 years, and it hasn't been an easy lesson, but it's not personal, right? It's not an attack against me. It's just people have different views, right? Of what works, what doesn't work, and what is factual. So we just try every day to keep getting good information out there, information that's grounded in science. And you know, when we see misinformation out there, we try to correct it. Lots of efforts at, you know, I mean, San Diego County actually passed an ordinance or some kind of a resolution about misinformation and trying to combat that. The federal government now is talking about this disinformation czar, I guess, that's going to be trying to combat information that's incorrect. So I think it's challenging because we have it every day, everywhere we go. But it's particularly amplified when we're talking about a pandemic and people having to make life and death decisions.
And I guess on a larger note, this is a really broad question, but I still think it's worth asking. Taking a step back, do you think social media has overall been beneficial for spreading accurate information, or has the misinformation been so difficult to deal with that you would say it's done more harm than good this past couple of years?
That's a tough one. I see Jose laughing over there. So I think that it has been beneficial to have social media in the sense that people who are going to believe public health come to our site and they get accurate information, right? People who are inclined to not believe public health, they're not going to come to our site, or they're going to come to our site and, you know, kind of maybe try to contradict the information that's there. So I think there's good and bad, just like with everything. I think that there's definitely benefit. It's a way for us to get information out. I think it's particularly helpful when we're trying to get information out about things like vaccine clinics or testing sites, or you know, even kind of changes as rules changed or mandates changed. It was a good place because it was constant and people knew they could go to our social media sites to get information. So I think from that perspective, it was really helpful. I think the flip side of that is, as you said, misinformation can spread like wildfire, right? And so for those that are trying to push information that's not always accurate, they have a platform and a way to spread that. So that's the downside. So it's really, it's a balance.
So yeah, and I guess in a lot of ways, you just have to weigh the pros and cons and do your best in your office to actually spread and to try to educate people on what is accurate. And what is not.
Exactly.
But then at the same time, you deal with the fact that there's some people that are going to spread misinformation
Yes.
and contradict what you're doing. So there really is no good or bad, it's more of a gray area, it sounds like.
Yes, yeah, definitely.
And we're talking about, communicating with, kind of bordering counties to Riverside County, you mentioned San Diego County. What does that look like in regards to, kind of doing that communication with them, whether it be through like misinformation, like trying to tackle misinformation, or, discussing plans for like within like the COVID pandemic and outside of that as well?
Yeah, so we actually have a very strong association statewide of public health directors. So people like me throughout the state. So there are 58 counties and 3 city health jurisdictions. All of them have health directors. And so it's called the County Health Executive Association of California, CHIAC. And so we meet on a regular basis. And so we did a lot of information sharing early on in the pandemic. We were meeting every single night. So at like 6 or 6:30 every night, we had a call with all of the directors. There is a similar group of health officers, so the physicians in all of the counties. And so that was happening daily. And then after about 1.5 years, we went down to a couple times a week. We're now at once a week that we meet. On top of that, there is the Public Health Alliance of Southern California. And so all of the Southern California counties, LA, San Diego, San Bernardino, us, Imperial, Ventura, and Santa Barbara. We also meet every 3 weeks. And during the pandemic, we met weekly so that we could share information. We would share protocols. We would, hey, I'm dealing with this situation. And what have you guys done about this? And that really, in a lot of ways, was a lifeline for us because there was very little that was unique to just one jurisdiction. We were all facing similar challenges. And so to learn from each other and share information, some county may have been a little bit ahead in rolling out testing, or some, like we, for example, were out in front in terms of getting vaccines out to farm workers. And so we were able to share how we did that with our neighboring counties. And so really just having that outlet was really important. And it was also important for kind of, I guess, support, so that when days were tough, you have the support of your colleagues that could really talk about things and lift each other up because the work is important.
Thank you. And to follow up with that, do you think, this kind of intense amount of communication throughout like the pandemic, right, has kind of improved communication overall between like different regions in the state?
Definitely, absolutely. Because since we were meeting so regularly, we knew each other. We knew kind of the challenges in everybody's jurisdictions. When one of our colleagues was going through a tough time, we felt for them because we knew exactly what they were feeling. And so now I think that there's a lot more camaraderie amongst all of us. We know each other a lot better. And we also pick up the phone and call each other a lot more, I think, because we do have that connection and now that history of working together. So I definitely think it's improved. So thank you so much.
Awesome. So I'm gonna switch to a little bit more of like current events. So recently I was kind of like reading up. So recently there has been lobbying efforts in order to score some big wins for California's public health. I'm sure you've heard about it. So recently the legislature has passed a $300 million annual boost to funding for public health agencies, a coalition also known as California Can't Wait.
Yep.
So actually I have a quote here from you directly. So,
Uh-oh.
so a lot of what we did is just educate members about what public health does. So what would you say public health does? Like what are the steps that you would take in your day-to-day basis, or that you have taken in public health, and like what are the steps that you use to educate people, and like what are the plans? Like I remember you talking about like your lovely big plans, like what goes into that? Like where do you begin?
Yeah. Oh, so there's a lot in that question.
Yeah.
So the California Can't Wait Coalition, maybe I'll just give a little bit of background on that. So the CHIAC, the Health Directors Association, is one of the main players in the California Can't Wait Coalition. And so every year, but particularly during the pandemic, we've spent a lot of time educating the legislature about what public health is and what we do. Because one of the things about public health is when we're doing our job, nobody knows we're there, right? Because people aren't getting sick, people are getting the resources they need. And so it's very easy to cut public health because you don't really know what you're cutting, right? And it's not until you see the downstream effects of those cuts that you go, oh, maybe that wasn't such a good idea. And so I love going to visit with the legislators because they're very receptive and they love to hear about the work that's being done, and they largely don't know. I mean, there are some exceptions to that, but by and large, there's a lot of room for education. So when we go in and do that kind of education, it's mostly about how, for example, at the start of the pandemic, our health department was about 700 people. Within about 3 months, we had to more than double to 1,500. And so because of that, you can imagine bringing on 800 people, right? In a very short amount of time. It was basically like, okay, well, if you're breathing, we'll hire you and teach you how to do case investigation and contact tracing. I know I shouldn't have said that. But in all seriousness, so we had to put together very intense training programs to get people up to speed to be ready to do the case investigation and contact tracing that was required from the pandemic. If we hadn't been cut, we could have had some surge capacity within the department, and we could have gone farther, had more people to do the case investigation and the contact tracing, and maybe been able to implement testing quicker or implement, whatever the issue was, right? Our case investigation protocols, contact tracing protocols. But because we had to ramp up and train folks, there was a little bit of a lag time. And it wasn't just us, this is true across the country. Everybody had very similar experiences. And so those are the kinds of things that we talk about with our legislators, like, here's what public health does, but here's what we can't do when we don't have the resources to do, right? So another example, in Riverside County, chlamydia, we have about 13,000 cases of chlamydia that are diagnosed every year. And those are just the ones that are reported to the health department. We don't have the resources to investigate those. We only do very high risk chlamydia cases. So for example, if a woman is pregnant, then we'll investigate. I would love for us to investigate every case of chlamydia because I want to be able to say, here, we're going to make sure that you're treated properly. I want to talk to you about your partners. I want your partners to be treated so that we can really get our arms around this chlamydia problem. But we just don't have the resources to do it. So we talked to them about, if you were to invest in public health, here's what I could do with these resources. So that's kind of how it works with the legislators.
Yes, that makes sense. And just kind of another follow-up question. So how would we present, like, what is public health to our peers, our families, our loved ones? Like, we want to make sure that we raise awareness and advocate for public health. So how would you define public health in your own words?
Ooh,
Yeah.
okay. All right. So I think, really public health is, the goal of public health is to ensure that folks live long and healthy lives, right? And so that looks differently to every single person, right? We want people to live, not to steal the Kaiser moniker, but thrive, right? I mean, it just, it works in so many different situations. And so thriving is different for every person. And so public health has a variety of programs that's going to help lift up even our most disadvantaged communities so that they have better chances at being successful in their own right? And so we have a big focus on social determinants of health because we know where people live, work, play, pray, all impacts health outcomes. And so we want to make sure that they're living in healthy communities where they have sidewalks, they can walk to school, where they have access to fresh fruits and vegetables and farmers markets. We want to make sure kids can walk to school safely or ride their bikes to school safely, right? We want to make sure that employers have safe practices so that employees are safe in their workplace. So all of those things impact health outcomes. So we work as part of a system, right, to improve all of those things, because as a public health department, we can't do it alone. There are so many community organizations, faith-based organizations that we partner with in order to raise health. But really our goal is to raise the health, improve the health of the community so that people can live long, meaningful, happy lives.
Yeah, I definitely understand that. Because I feel like for public health, it takes it to more of a community But like medical is like very one-on-one basis, like
Yes,
instead of learning how to break prevent something, you just want to treat it on the spot. But like public health is very preventative as well as it has interventive.
Yes.
So,
yes, very well said. And there's you may have heard this throughout the pandemic, we use a program called the Healthy Places Index, or HPI. It was developed by the Public Health Alliance of Southern California that I mentioned, but it's used statewide. The California Department of Public Health also used it. And it looks at 8 different policy areas of wellness and health. And so it includes things like economics, education. It looks at things like tree canopy, right? Because of climate change. So it looks at 8 different policy areas. There are 26 different indicators, and it ranks counties. And you can also go down to cities and census designated places. But if we look at a county ranking, we get a score of 35 out of 100 for Riverside County. If we look at our neighbors, Los Angeles County is in the 50s, about 56. Orange County is in the low 70s. No, sorry, Orange County is about 65. San Diego's in the low 70s. So we have a lot of work to do to get our community health up to even at that of our neighbors, right? And there are a lot of different reasons for that. We have very different socioeconomic status. We have very different population composition, but nonetheless, all of our residents have the same right to thrive as everybody else does.
thank you.
Now that you talk about the social determinants of health and like accessing communities that are really disadvantaged, like how difficult has it been to at least reach out to those communities or help communities, which is like for populations such as the homeless population during this pandemic, since they don't have the greatest access to resources either.
Yeah, absolutely. So I think one of the biggest benefits, if I can say there's a benefit to having lived through this pandemic, is the fact that we have such a focus on equity right now. And because the pandemic has so disproportionately impacted populations, we really now have everybody's attention, not just health folks, right? But people at all levels of government and all different disciplines are getting a better understanding about what equity means. And so what we did in Riverside County is, and I said this earlier, we recognized really early on that as government, a lot of times those communities that are more disadvantaged don't trust government, right? And so it's not going to do any good for me to go into those communities and talk to them because they don't trust government. And so we've partnered with community-based organizations and faith-based organizations. And so we've used churches to hold testing events, but they're not held by us. We work with the churches. We make sure they have the vaccines. We provide nursing staff if they need it, but it's really that church community vaccinating their community, right? Because their pastor, their priest, whatever it may be, is a trusted messenger. And so that person is able to answer questions, allay fears, and reach their community much better. Similarly, we have partnered with groups like in the Eastern Coachella Valley that are routinely working in farm workers. And so when the pandemic hit, we contracted with them, again, provided them with the resources that they needed so that they could continue their work and include education and outreach around COVID. And so, I think there is no way that we would be as successful as we were with some of our outreach campaigns around testing and vaccination if we didn't have that partnership with those organizations, because they live in that world day in, day out, right? They know how to reach folks that are working in the fields. They know how to get the message across. They know what the common myths are, misinformation, right? That then they can address. And so they're just, it's incredible to watch them work. I love to go out into the field with them and just observe how they are able to interact with the community. But it's really that partnership between the public health department and those community groups and faith-based groups that really is able to reach people. I think the other challenge that we have though are getting resources into those communities that have very few resources. So in a lot of communities, they think, well, if I set up, a vaccination site at all the churches will be good. But there are a lot of people that don't have vehicles. There are a lot of communities that don't have bus routes. And even if you do have a vehicle at $6 a gallon, are you going to pay to drive to church to get a vaccine, or are you going to buy groceries for your family, right? And so again, recognizing that, really partnering with those community-based groups to develop transportation so that people can get transported to the clinics and get the resources that they need. Or we have like, I don't know if you would call them like hotshot teams, where you go out into the community and, we set up in a park and say, hey, if you want a vaccine, we're here. Or if you have questions, we're here. Or if you need resources, we're here to try to help. And so that's really the model that I think is going to be kind of dictating how we move forward. And as a department, we're really fortunate. We've received some funding for equity work. And one of the things we're doing is we're setting up teams that will continue to do that, working with communities and those community-based organizations to reach those individuals that don't have access and need those extra supports to get the things that they need.
That's really exciting to hear that. Honestly.
Yeah.
Thank you.
Thank you so much, Ms. Saruwatari.
Sure.
I'm going to pose the last question before we let our audience get in on
Okay.
this session here. No problem. So if you don't mind, I have a question in regards to your career path and to where you are now.
Sure.
So I'm aware that you graduated from UC Berkeley with a degree in biology and infectious diseases. So if you can explain a bit why you decided to go into public health after graduating, when often people are pushed into biotech when graduating there in similar degrees.
Yes, absolutely. And a lot of my colleagues are, my student friends, when I was in biology, my last year, a lot of them did go into biotech, particularly being in the Bay Area. A lot of them went into that kind of work. For me, it was all about being able to work with the community. And I knew I spent a lot of time in the lab between, the molecular biology work and also the infectious disease work was a lot of lab work. And while I loved the lab, I like to talk too much, and I'm a social person, and I like to be, I guess, more boots on the ground, hands-on, and I really enjoy the interaction with the community. And so that's kind of where I tried to think about what is it that I really wanted to do. And so I thought about medicine and that individual interaction, right? But I thought even that's not really for me. I really want kind of thinking on that higher level community basis where we can set and implement policy that's going to help lots of people rather than just an individual. So that's kind of where I kind of took that divergent path and went into public health.
Okay, thank you so much for that response. So at this time now, we're going to transition to the audience Q&A. So to our audience members right here in person, if you have any questions, please raise your hand. And to our online audience members, please submit your questions via the Q&A box instead of via the chat function. And I will pose your questions directly to our guest speaker. So without further delay, the first question will be from our Zoom audience member, Jenny Lowe. Her question is, what should a student like me do to get involved in my community's public health policy?
Oh, great. So I think that there are many opportunities to volunteer and be a part of the public health system, whether that's through community-based organizations. I know that there are lots of groups, all of the CBOs that we work with, and there are probably, 50 or so that we work with, and the faith-based organizations, they use volunteers. And so that's an opportunity to really get familiar with the work that's being done. At the health department, we take interns. We also take volunteers. And so there's an opportunity to work with us and kind of see from our perspective what type of work needs to be done and how you can influence policy. So I think the most important thing is to try to get some experience to see if this is the right kind of work for you, and to see what area in public health you want to go into. I mean, the public health as a discipline is so broad. There's really room for everybody if you just want to take the time to find your spot and find your passion.
Thank you so much for your response. So our next question will come from our in-person audience.
Yeah, so I actually have a question when you mentioned about partnering with the community organizations. So of course, you guys only have so many resources. How do you go about actually choosing?
Yeah, that's a great question. All of them are great questions, so I should just stop saying that, right? So we, as public health, we have had relationships with community-based organizations for a long time. I would say that they just were not as robust as they could have been. And so when we started down the path of the pandemic, we actually reached out to one organization. It happens to be, it's called Visitation. They're a statewide organization, but they do a lot of great work in Riverside County. So reached out and talked to them, talked about what their skills were that they could bring to the table, around outreach, education, translation services, contact tracing. And then they suggested others that we could work with. I also had a couple of CBOs reach out to me directly, and we ended up contracting with them. And so what we really tried to do is we looked at all of the existing contracts that we had and partnerships that we had, and looked at, are we covering the sex of the population that we really need to? So do we have CBOs that really work with the African American population? Do we have CBOs that are skilled at working in the Latinx population, the Native Hawaiian Pacific Islander population? And so we made sure that we had that kind of coverage, but then also looking at things like CBOs that work with LGBTQ populations, and youth and seniors. So, looking age, looking race, ethnicity, and looking at even different types of skill sets. We did work with the Girl Scouts. And they were, we had Girl Scouts literally making cloth masks at the beginning of the pandemic when we couldn't get them. They would show up, and I'm telling you, those folks were awesome, right, at helping. And so beyond that, the other thing that we're actually in the process of doing right now, because I do believe there are other CBOs and faith-based organizations we might not be aware of. So we opened up an RFP, so a request for proposals. And so we send those out to all of our networks and say, hey, if you can provide these services, then apply. And our goal is to get funding out to as many different organizations as we can, so we can serve as many communities as we can.
Thank you so much. So our next question will come from the in-person audience. Yeah.
So in the beginning, you talked about helping women who are pregnant and resources, and obviously they go to hospital visits, doctors until delivery. So what about postpartum? I feel like there isn't any support there. It's only like how the baby's developing, and then as soon as they deliver, it just stops.
Yeah.
So
Yeah, definitely, absolutely. And so I think, the governor actually has really doubled down on that concept. And so he has funded home visitation at a much higher level. And so we've been really fortunate for that. So we have things like the California Home Visitation Program and the Nurse Family Partnership. And so now what we do is we get women who are, I believe it's around 24 weeks pregnant, give or take. And we follow them through 2 years post-pregnancy. And so what we do is, we make sure that the baby is getting to their well baby checks, but that also mom's issues are addressed and that she's healthy. And if she had any problems during pregnancy or during the delivery, those are addressed and she's healthy. But we also help her get on the road to, if she needs to finish her education, then we help her with that. If she needs to get into the workforce, we help her make sure that she knows how to do that. And so it's really a comprehensive program, and it's really amazing. We do a graduation at the end where it's just, it brings tears to your eyes. You have these moms and their little ones, right? And they are much more prepared for success because they have been, they've been hand in hand with our public health nurses and staff that really want to see them succeed. So I completely agree with you. We can't stop right at delivery. We have to keep going. And so I think that that's a path that's going to continue to be developed over time.
mostly because mothers can get postpartum year after.
Yeah, sure. Yeah, absolutely. Yep, for sure.
So our next question will actually come from the Zoom audience. So this person asks to Kim, what made you decide to stay within the Inland Empire for your career? Did you ever have a chance or desire to work elsewhere?
Yeah, so I actually was just talking about this the other day with someone. So I was working in San Diego County and I loved my job in San Diego. I was a senior epidemiologist working on a lot of bioterrorism things because it was right after September 11th and the anthrax attack, which many of you may not even remember, but that's okay. I got engaged. And so my husband now, my to-be husband was in Pasadena. And so I was thinking, okay, well, I have to figure out where we were going to live. And I left Pasadena too. So I kind of wanted to get up that way. So I had a friend who worked in Riverside who said, hey, interview for this job. And so I said, all right, I'm going to be getting married. Why not? It's at least like, an hour closer to Pasadena. And so I was going to interview for the job and It happened to be a super busy day. We had a big outbreak that was going on. And so I called and said, I can't make it to the interview. And they said, well, can you just do a phone interview? So I said, all right, I'll do a phone interview. So anyway, I was fortunate enough to be offered the job, and I thought I would stay in Riverside for maybe 2 years until I could find something closer to home. And to be honest, I never even have looked for another job because I have loved the community in Riverside. I've loved the support from the county, right, for the health department. And I just have had a lot of great opportunities to grow professionally and I think personally. And so I have not looked for other jobs. Yeah, I think Riverside is a great place.
Well, we are grateful for your work that you've done in Riverside County. So our next question will come from another Zoom audience. So they asked, as Director of Public Health, do you have influence on advising others within Riverside on ways they can implement healthy living into their projects and works? For example, encouraging residential developers in Riverside to build in a certain way to increase walkability to schools for kids.
I love that question. Yes, so in Riverside County, we were one of the first counties in the country actually to hire an urban planner. And so we have an urban planner on staff that has done amazing work. His name is Miguel Vasquez. Miguel has done amazing work with our partners in the planning space. And he participates in like the planning associations. He works very closely with our planning department, city planning departments. And so his whole focus not his whole focus because he's incredibly brilliant. So he brings a lot to the table, but a lot of what he does is looking at things like livable communities. So how do we have walkable communities? How do we make sure that we have access to fruits and vegetables, education, all of the things that we need? And in fact, one of the things that Miguel has done in cooperation with the planning folks is develop a healthy development checklist. And so it is not completely rolled out, but we're in the process of trying to get it to that point where it's not requirements, but it's recommendations for developers. And, you know, sometimes we have to take baby steps, right, to get to the outcomes that we want to get to. But it's recommendations for things that developers should consider when they're planning communities and planning developments. So things like sidewalks, community gardens, tree canopies, all of parks, all of those things that are really important and we know help long-term with health outcomes. And so yes, that is an area that we very much are interested in as a health department. Over the last 2.5 years, hasn't been a huge focus because it's been all hands on deck for the pandemic, but definitely something that we're picking back up and hope to move quickly to make some progress.
Thank you for your response. We will now have our final question, which will be an in-person question. So are there any last minute questions?
Sorry. Thank you very much for coming and sharing with us. I was just kind of wondering how you talk about the different aspects of public health. How did you choose kind of an admin route versus like epidemiology or research or even like social media and education that way?
Yeah. So when I started out, I was in epidemiology. So I was doing case investigations. I was running numbers. I was creating spreadsheets, graphs, all of those things. And I really loved that. And enjoyed that, and then went into more of the emergency management side. And then I think, you know, I've been in Riverside County, it will be 20 years in November. And so it's been kind of a natural progression to I guess, seek out promotions, right? And to take on more responsibility. And so as you take on more responsibility, you tend to have less hands-on. And so, you know, when my kids ask me what I do, I tell them I push papers a lot. But again, I think that it goes back to, as you work your way up and you get more responsibility and ability to influence others, your job becomes making sure that they have the resources to do what they need to do so they can be successful. So I kind of feel like you come full circle, right? So again, I love public health. I'm super excited about what's happening in public health in Riverside County. And I think that there's opportunities for everybody.
Okay, well, this is the end of our questioning time period. Thank you all. Thank you everyone for your questions. We have now reached the conclusion of today's events. Our deepest gratitude to Ms. Saruwatari for taking the time to join us today. Thank you so much for sharing your story with us. And special thanks as well to the students who joined me in the planning committee for this event, Claudia Nunn and Rayon Colon. Thank you for your work. Audience members, we hope you would join us for our next event on June 1st, featuring City Council member of Redlands, Denise Davis. You can learn more about the events hosted by the UCR School of Policy, like these, by visiting our website, spp.ucr.edu. While you're there, you can also learn more about our Master's of Public Policy program. Thank you all for being with us today, and we look forward to seeing you at future SPP events. Until then, thank you. Goodbye.